I do want to make just a comment of that. Everybody knows through COVID, or we realized through COVID, how important the sheriff position is. We saw throughout the country, sheriffs practically choosing how and when to enforce some of the laws that were put in place, both at the federal level and state and local levels. So I just want to reiterate the importance of this race to everybody. Thank you for everybody for coming out and listening to what these candidates have to say. We certainly appreciate it. So for the Sheriff's Candidate Forum, there will be 4 total questions with a closing statement round for a total of 5 rounds. Each candidate will have 2 minutes to answer each question. And to maintain fairness, the order in which the candidates will respond will rotate with each question. Time will be kept with Ms. Rhonda, and candidates will be notified when they have 30 seconds, in addition to when they have run out of time. At which point we ask the current speaker to conclude remarks without delay. So our topics for tonight include trafficking, mental health training, recruitment and retention of law enforcement personnel, and school security. So if you don't mind, we'll go ahead and begin. And Mr. Belk, make sure I got my orders right. Mr. Belk, you will begin with us, and we will just come right down the line, and I'll work with you guys as we rotate for each question. So this is talking about the I-77 corridor and some of the trafficking that we see in the Charlotte metro area. The I-77 corridor and the major hub of Charlotte presents significant challenges related to drug and human trafficking, especially with the rising concerns around fentanyl, which have been prominent or have been found in York County. Coordination between agencies is also critical in tackling these issues effectively. Given the alarming trends and the added complexity of these challenges, how do you plan to address these threats in York County and enhance interagency collaboration?
Thank you very much. I'll start off by saying fentanyl is my number one issue that I've been speaking of since getting into this sheriff's race. We as York County residents are seeing over 1,000 overdoses per year in York County. Not all overdoses are fatal. So that's quite a response, and this is county-wide. This is not just Rock Hill and Carowinds Boulevard that we're dealing with here. What affects the 1,000 can range from Fort Mill all the way to the outskirts of Hickory Groves. With these 1,000 overdoses that we're seeing, we are Narcaning. Anyone familiar with Narcan knows that reverses the effects of the overdose. We in public safety are Narcaning over 500 folks per year, not just law enforcement, but public safety as a whole, which is our fellows at fire departments and EMS stations. And we are seeing overdose deaths of about 50 to 75 people per year. It's way too much. It is a complete epidemic that we are dealing with. Go back to when the old 80s and 90s where they talked about crack kills. Fentanyl is real, and it is really occurring all over the county. As sheriff, we work currently, the sheriff's office and all agencies within York County work with a combined drug unit. My efforts are to expand the drug unit to where that you can have multiple complex investigations at one time. We must reinvest in that drug unit and work with all agencies within the York County area, from Fort Mill to Clover, to get everybody to reinvest and breathe new life back into that drug unit. Expand that drug unit, work with federal partners to tackle these large-scale investigations, multiple complex investigations at one time, and not giving up anything against quality of life issues that we're seeing on our public streets as well. Thank you.
Awesome. Thank you, Mr. Belt. Mr. Breeden.
Yeah. First and foremost, I agree we need to strengthen and expand the multi-jurisdictional drug unit. I think that one of the things that they do remarkable is they have an incredible partnership with a lot of federal agencies, local agencies, FBI, DEA, ATF, and also the DEA, as well as Charlotte, also SLED, some other agencies. And I think that those are really the only way that you can expand on some of these investigations and go into multiple areas. I would also like to bring back the highway interdiction team and assign them to the DEU. And when you do that, that allows the interdiction team to also work with the DEU. Sometimes they need cars stopped that cannot be stopped by the DEU. That also allows them to stop target vehicles that they know are coming in through the corridors. There's more than one corridor coming into York County on 77. You have from I-85, Gastonia, other places. You have from Charlotte. You have a lot of corridors coming in. So that hit team can also, when they're not actually working those active investigations, they can be out stopping cars, doing investigations, and they can look for the three things that lead to the next investigation, and that is drug, money, and guns. And then those things lead to more informants, which lead to bigger cases, which leads to more success with the drug unit. The drug unit was in the past, and they have been fighting fentanyl more than you could ever imagine, and they have had two of probably the largest fentanyl pill cases combined with the FBI that the FBI has seen. There were 5 multiple state operations, and I think that, to me, I think to strengthen that, to give them more, and then also have that other piece with the uniformed deputies and marked deputies allows them to really enhance what they're doing and take those cases to the next level.
Excellent. Thank you, Mr. Breeden. Mr. Blevins.
Just like Tony and Mike touched on, we do need to expand the DEU. They have not had a personnel expansion in the last 3 or 4 years that I know of. The thing with drugs, all drugs, is they are married to other crimes, to the homicides, to the robberies, to simple property crimes. So when we knock out the drug problem, then we're going to reduce the other crimes that also plague the county. So I also, like Mr. Breeden here, I also want to bring back the interdiction unit. When the interdiction unit was on target, they made some good solid cases on the interstate and was able to bring those cases in, and the DEU was able to expand on those cases and make several good arrests. The other thing is educating the road officers, the ones that are on the road, to know what they're looking for, to know how to make that case so that we have good solid cases coming from the road. The other thing is working with our legislators to strengthen the laws. We have a law now that I just learned. Well, if a deputy goes out and has to Narcan somebody and there's drugs laying there, nobody gets charged with it. Nobody. Because they're a victim. Even though they OD, they're a victim. So we need to fix that so that we can get these people in front of some of these drug programs. The Solicitor's Office has great programs that we can get these people in to see if we can get them some help. Because the officers go out and Narcan this person, 2 weeks later they're out doing the same person. It is just a perpetuating cycle. It just continues and continues. So we have to have something that the officers can put their teeth in so that we can stop this problem. Thank you.
Awesome. Thank you, Mr. Blevins. Mr. Clevenger, floor is yours.
Yes. So, while working at the sheriff's office, I definitely saw the effects of fentanyl along with other drugs from one end of the county to the other, from Fort Mill to Hickory Grove. And as a sheriff, I want to empower everybody within the sheriff's office. We got to see more proactivity from the patrol units. We cannot rely solely on the specialized units to deal with the high-profile trafficking cases, because it's a problem all the way from the user to the dealer to the trafficker. And you have to hit it on all levels if you want to have a severe effect on the community. And that's how it needs to be approached, multiple prongs, not just one. That's all I have. Thanks.
Thank you, Mr. Clevenger. And Mrs. Tolson.
Thank you. Thanks. So I think we're all going to echo the same thing here. A lot of us, on a lot of things tonight. I think we all agree that fentanyl is a horrible thing, and we need to eradicate it out of our community. Which that's a tough job. I've heard moms and dads cry after they lose their children to fentanyl. It's sad, and they don't have anywhere to turn. There was some legislature, I think I don't think it even passed the Senate 1 bill that would make it a homicide if someone gave fentanyl to someone they OD and they ended up passing away. So I don't know where that bill is now on some of the legislation, and you can tell us that is. However, let me just say this, that the York County Sheriff's Office, the DEU unit, does need to be expanded, for sure. There have been operations within the York County Sheriff's Office that has done amazing things up around the Carowinds Boulevard border. Carowinds Boulevard is a cesspool. And working with the hotels there, working with the different businesses up there, we were able to, at the sheriff's office, come together last year and pick out. I know we recovered 74 stolen vehicles around the Carowinds Boulevard area during March Madness. It was a proactive investigation that was done up there for us a weekend or two, and they were able to lock up, I think, like 50 people during that whole process. And so they were able to develop informants from that. They were able to recover drugs from that operation, stolen cars. And so the point is I think targeting that area with proactive investigations, working with the business owners up there, and like all of us have said, there's programs within the solicitor's office to get people inside of these programs and get them back on track where they need to be, try to get them off the drugs.
Thank you, Mrs. Tolson.